From KARK4 and Fox 16, this is a special report. Here's Mitch McCoy.
Hello and good afternoon to you. I'm Mitch McCoy here at KARK4 and Fox 16 in Little Rock from Studio B. We are monitoring live pictures. The governor is expected to hold his media briefing here in the matter of moments, and we are going to watch that together. Good afternoon to you. There are a couple different things that we're going to be watching over the course of this briefing. There are a couple topics that the governor is expected to discuss. Some of the topics of conversation include the new ARHOME waiver application. That is one of those announcements that we're expecting to happen here in just a few moments. We're also being told the governor is going to discuss cybersecurity in the state of Arkansas, that is going to be some kind of an announcement. The governor is at the Department of Human Services building in downtown Little Rock. You see the governor coming up right now. Let's listen in live as the governor holds his weekly media briefing.
Secretary Gillespie, thank you for hosting us today and allowing us to really focus on something that you've been working very hard on, which is our home initiative, and to make an announcement in relation to our home, as well as another announcement shortly thereafter. And first, I want to say I'm deeply grateful for the work of our DHS employees. Over the last year, you have been on the front line. You kept our state moving, both in terms of health care, child welfare, casework. You continued on day in and day out doing the work that is absolutely necessary, and I thank you for that. And one of the things you worked on, of course, with the leadership team and with the General Assembly was the initiative that we call Our Home. And first, I want to talk about the timeline for the Our Home initiative and to announce that we are prepared to submit the waiver application to the Biden administration on July 14th. And that is after a long effort, working with the General Assembly, seeking the authorization. And there's some steps that we have to go through to get there. And I want to review that first. If you go to the timeline, you'll see that we've already begun the state public comments, and that we'll have 2 public hearings in reference to hear the public on their comments about it. And then on July 14th, we will submit the Our Home application to the Biden administration. They will then have to do another federal notice and ask for comments from a federal perspective. And then we will, once we get their approval, which we hope to have in November or December, which is actually critical, because you have to understand that without approval of this waiver, then the current waiver ends December 31st. So this has to be approved in some form in order for the expanded health care that we have in Arkansas to be available. And so, of course, January 1, 2022, we expect Our Home to be live and be serving the people of this state. Just to refresh a little bit on history, we had the private option, we had Arkansas Works, and now Our Home. And every year, it was predictable that it would be extraordinarily controversial as it went through the legislature. Well, this year, we did not have the same controversy. We did not have the same number of votes. It was accepted by the General Assembly, the authorization, so that we can pursue this waiver. And the reason this year was different was because of the work of Senator Missy Irvin, who is here, and Representative Michelle Gray, who can't be here today. But I want to recognize both of them because it was their constant work with Secretary Gillespie and her team to fine-tune the approach that we have. And the new approach that we have sends the message that we are serious about the health care of Arkansans. We are serious about improving their health. And we are tired of being low in the totem pole, low in terms of the state rankings on health outcomes. We want to improve those in every area. And this was driven by Senator Irvin and Representative Gray and the General Assembly. And while the uniqueness of the Arkansas Medicaid Expansion Program is commercial insurance that covers the expanded Medicaid recipients, we are adding a new ingredient to that insurance coverage, and that is a new approach to improve the health of all Arkansans. The new ARHOME program challenges the health plans of the insurance carriers to do more. The nature of a health insurance company is to provide access to care and protect against unforeseen financial costs. ARHOME adds a third dimension to the role of health insurance plans. The new role is to work with their members to help them to get healthy and to stay healthy. And if we can accomplish that, we're going to be lowering costs, we're going to be improving the quality of life, and we're going to be justifying this investment of the taxpayers. The health improvement is now a defined responsibility of the qualified health insurance provider. Defined responsibility of health improvement. And so we will continue to work with the General Assembly over the life of the waiver to set goals, specific outcomes that we want in health improvements for Arkansans. This will be done through incentives for the members to increase their employment, their education, their training. The state will make training and other assistance available to lift members out of poverty and into work. That is the objective, better health outcomes, and part of better health outcomes is a better economic future as well. Why is all of this important? It is important because it is well documented that simply living in a rural area increases the risk of poor health. Arkansas has one of the highest rates of working adults on disability. ARHOME pushes health insurance plans to help in the effort to allow our citizens to move up economically. That is our objective, that is our goal. How do we do this? If we look at the next graph, this outlines some of the improved health outcomes and how we're going to achieve those goals. You can see that we're going to concentrate on maternal life, where we can work to establish birthing hospitals and better home visiting programs that are in those birthing hospitals, where we can have assistance for mom and baby to reduce the instances of child abuse, neglect, and other domestic violence, and promote school readiness and economic independence. But it's also about partnering with our rural community hospitals to increase their engagement in improving health of the citizens in their communities. And that could be from food insecurity issues or instability related to shelter and work. It could be substance abuse counseling that is needed. It could be mental health that's an issue that we need the local community hospital to assist in those outcomes and to provide assistance to them. And so the rural community hospitals will play a very important role in us achieving success. ARHOME will pay rural hospitals to recruit and train coaches or peer specialists to engage ARHOME members one-on-one. It will help pay the costs of crisis mental health services by operating acute crisis units. That will be supplemental to the crisis stabilization units that the legislature created, that we have 4 of those pilots. This will be an addition that will allow those mental health services to be available in some of our more rural communities. And we also have a web-based tool that has been separately announced, Ready for Life, that will help low-income Arkansans find worker training opportunities and assistance and ultimately a job. And so this effort in health outcomes also ties in to employment opportunities and training through the Ready for Life initiative. The goal is to move out of poverty and into independence and better health. The General Assembly has done its job, and now we need to win approval from the Biden administration. I already have a trip planned after July 14th to meet with the administration and help to advocate for the waiver that we have requested. And so with that, I'll take questions a little bit later, and Secretary Gillespie will be available if we have questions to her on that particular topic. But I also wanted to recognize Secretary Amy Fetcher and Secretary Mike Preston, two important members of my cabinet that have joined together and to help me to create an Arkansas Cyber Advisory Council. And that's my second announcement today, that we are all aware of what we've seen in our nation through the Colonial Pipeline ransomware attack. We've all been aware of the challenge we face with the JBS, the meatpacking cyber attack on that meat processor that alerted us to the risk in our agricultural community from cyber attacks. But in addition, governments and public entities are vulnerable as well. We've seen a 1,400% increase in each of the last 2 years in cyber attacks against public entities. Now, that includes the state, that includes municipalities, and we are vulnerable and we have to improve our security. We have done that in my administration. We've invested more in cyber protection, in enhancing our security and our systems, but we have to do more, and it has to be coordinated at the highest level, and that's the reason for this Cyber Advisory Council that I'm creating by executive order that I will sign today. It designates Jonathan Askins, who is here, Jonathan, who is our Director of the Division of Information Services. He will be chair of this advisory council. And it will also include Mike Preston, of course, Department of Commerce, Jamie Cook, Department of Public Safety. Secretary Gillespie will be on there because at DHS there's an enormous amount of data that has to be protected, and her voice is important. Emergency Management will be on there, Kendall Penn, the Arkansas Military Department, and Johnny Key, Secretary of Education, and others that you will see. The mission of this advisory council is to help give us a roadmap as to what are the best practices in state government with the American Rescue Plan money that we have available that specifically includes investment in cybersecurity. This advisory council will be making recommendations in regards to the investments that we need as a state to protect our systems, to protect our information. They will identify future tasks and goals, will be making recommendations as they go along the way. And so this is a second important initiative that I wanted to announce today. And then finally, I cannot end without commenting on our cases. Secretary Romero is here. If we just put up the chart, you'll see that bottom line is we had 302 cases, are always up on Tuesday. You look at our hospitalizations, is just up 1. The active cases is up about 109. But what I always look at now is the vaccinations, because all of the other statistics can be controlled by how we're doing getting vaccinated. And I love the storyline behind me. I believe, Secretary Gillespie, these are members of your team here that have put their testimony up there as to why it was important for them to get vaccinated. And that's the kind of messaging that is important. We had 6,500 doses given out in the last 24 hours, which is pretty good. And I'm starting to see a correlation between active cases and people getting vaccinated. It's just human nature. As you see a threat, more people get vaccinated. They want to protect them in the future. And so we got to catch up, and I hope that that will continue to increase. With that, again, Secretary Gillespie, thank you for your hospitality today, and with that, we'll take any questions.
On the ARHOME waiver, I know you said that you're going to Washington, talk with the Biden administration. Ahead of that, have you gotten any indication from them how open they are, if there are any areas of concern that they have with the waiver? And the second part, if they reject all or part of this waiver, what does happen then? Is it back to the drawing board for the legislature? Does it revert to what you had before? Kind of what are the options then?
Well, I fully expect the waiver to be approved, and you've got to remember the Biden administration has just recently got their top officials at HHS in place and CMS, and so a lot of this is new to them, but I know that Cindy and her team, led by Dennis, has been in communication with them, Dennis Smith, and they're positive toward it, and you know, they're going to look at it. They're going to wait to see what the specifics of the waiver and what the public comments are, but I expect it to be approved. Naturally, they may come back and say, well, maybe you ought to look at changing this or changing that. Luckily, we can say, well, you've got to remember that the General Assembly authorized this, and so that sets the parameter on it. So I expect it to be approved, and it has to be approved by the end of the year. Otherwise, the expanded health care would end, and that's what no one wants.
But if they rejected any part of it, even just part of it, that would have to go back to the legislature?
No, it would not necessarily have to go back to the legislature. If the waiver is consistent with the legal authorization that's been given by the legislature, then within those parameters, we can do some negotiation and adjusting if need be.
But if they flat out reject the whole thing, that would go back.
Correct.
As far as the increase in cases, there seems to be kind of an uptick recently. What do you think is behind that? And other than vaccinations, is there anything that you consider, you know, to try to slow the spread of the virus?
As to the reason, and you know, Secretary Romero and our conversations, of course, we look at the Memorial Day weekend in which everybody was together, we celebrated, and you know, had all of the family occasions, so those gatherings could be a reason for it. It's a little bit hard to say because we really have just moved back to a normal society in Arkansas life, whether it's sports, school, or whether it's work, and so all of that increased activity would have a bearing on it, but there's only one thing that we can do is to encourage vaccinations. And we're doing that every day. We put incentives in place. We've got our public messaging. So it's really up to the public. Our hands are limited, and it's a matter of responsibility and everybody taking the action that they need to.
On the ARHOME, as far as public comment, what are you hearing from folks? Any concerns or questions that you're hearing from the public comment?
No, and I'm going to let Secretary Gillespie to answer that as well. But you know, the first audience that we have is the General Assembly, and he was well received there. And of course, again, thanks to the leadership of the Senator Irvin, who led that effort, and Representative Gray. So we're not seeing negative comments about it at all. And Secretary Gillespie's been working hard with the rural hospitals, educating them on this, the role and opportunity it presents to them, and I'll let her comment on that reception.
Public comment started on Sunday, so we are at the very early stages of it. So we haven't been getting the formal public comments back yet, but we have been holding meetings with different stakeholder groups, whether it's the hospitals, whether it's advocates for children, you know, just there was a meeting on Saturday with the AMDPA, the Minority Doctors and Dentists organizations. So far, really excellent response to what we're doing, and people seem very comfortable with the direction we're going. It's genuinely, people are excited that we're really focused on driving health improvement and that we're focusing in on the health of children and babies. And so we're not hearing anything negative so far.
And I invite Senator Irvin to comment on what she's hearing about the plan.
Thank you, Governor, and thank you again for inviting me to come and speak and really celebrate the folks at DHS for all of the work that they did. It was tremendous, and working in partnership with us in the legislature. This was a year-long effort, or more. But to your question specifically, so many of those conversations happened in the development of the legislation, and I think really it's now just implementing this big dream we have to utilize this program to really drive outcomes and make sure that we can do all we can to bear the full strength of government assistance that's already available to many of our citizens through this program to help improve their circumstances. And particularly in the maternal Life 360 home is just to try to prevent those premature births or those low weight birth babies, and to get prenatal care and get them connected and give the resources available to them so that we can not just help the mother's opportunity, but also that unborn baby's chances of a more successful and healthier life if they get the right prenatal care. That's just an example of that one. But I think there's just a lot of dreams going on about how we can accomplish this, but I will just say it's been a great conversation and dialogue with our hospitals, and those are going to be all size hospitals. Your rural hospitals will be engaged in the rural Life 360 homes and the Success Life 360 homes, and the maternal ones will be your birthing hospitals, which will be your bigger hospitals, and then the Success one will be in urban areas and rural areas. So it's just a ongoing conversation and dialogue and intense work of partnering with those hospitals and all those entities that can kind of come together to help solve the problems and to achieve the model that we put forward, which will then meet those goals of driving those health outcomes and improvements for Arkansas. And that's what we're interested in, and that's an accountability for those taxpayer dollars we're spending. We want to make sure we're justified in spending them and that we have results because of the spend. And so that's what the program's aimed to do. But it's exciting. I'm so excited to have been a part of it, and I think the legislature is really, really proud of it. Thank you.
Teachers are expressing concerns about the potential insurance hikes that they're facing right now, and they've been calling on legislature or they've been calling on the state to set aside $70 million rather than the $35 million to fill that shortfall. Why is that not being looked at as an option, or is that being looked at right now?
Well, all the options were considered by the Board of Finance, which has been assigned the responsibility for reviewing the health insurance plans for state employees and teachers and to make recommendations on it. And so this is a recommendation coming out of there. There's other recommendations that are being looked at because it has to be a combination of solutions to make sure we hold down the increases in those insurance premiums. So this is just part of it. That was a recommendation that came from the Board of Finance. Okay. With that, thank you all for being here today, your attention to this, and have a great day. Thank you.
And there's Governor Asa Hutchinson talking, excuse me, for a few moments where he was talking a little bit about the ARHOME and also talking about cybersecurity, some significant announcements today, specifically regarding the implementation of ARHOME, setting that timeline, and also announcing a cyber advisory council. Also learning today that there are 302 new cases of COVID-19 in the state of Arkansas. So there's quite a bit to recap here. And so I want to first start with COVID-19. COVID-19, we learned today there were 302 new cases of the coronavirus. And that is somewhat interesting because we have seen at times a spike of over 300 new cases a day. It's now happened twice in a matter of days. Worth noting, there were 6 additional deaths in the last 24 hours, and there's 1 additional hospitalization today. So let's talk about the Cybersecurity Advisory Council. We're learning today by executive action, the governor is going to be, executive order, the governor is going to be implementing a new State of Arkansas Cyber Advisory Council, basically a cybersecurity council that will help make sure that the state is protected against a cyber attack. We have, of course, seen numerous majority major companies. We have seen some municipalities targeted by cybersecurity across the country by hackers, but the governor says that this is vital for the state to protect its cyber infrastructure, because there have been instances where hackers are attacking entities like cities, like the New York subway station, if I remember correctly. So that was a significant announcement today. We're learning that the Director of Public Safety, Jamie Cook, is going to be on that, along with other secretary positions there on that council, including some of the state's top cyber employees. So that came down today. We're also learning of this announcement, and we're talking specifically about ARHOME. We're learning that there has been an implementation timeline set forth. We're learning that state public comment has already opened on this. And so what I want to do is I want to go to our smart board, and I want to be able to show you that timeline. Let's go ahead and do that now. So this is the timeline that Governor Asa Hutchinson just announced a few moments ago, and this was unveiled during his news conference as ARHOME prepares to go into effect. This is the state's new healthcare system, Medicaid. So June 13th, the state public comment will begin, and so that began just a couple of days ago. There will be a public hearing on June 21st that will be taking place at noon. The next day at 4 p.m. there will be a second public hearing. There will be numerous reviews, including federal public comment, to follow after some of the state public comments. January 1, 2022 is when ARHOME is expected to officially go into effect in the state of Arkansas. It is worth noting that there is a lot of forecasting, if you want to call it that, that goes into putting this program into effect. If you notice down here at the very bottom, the governor's office saying that these are all expected dates. They could change as different things come up. So that is what was unveiled today. This is the implementation timeline that Governor Asa Hutchinson just put forth and announced just a few moments ago. And we'll have that all on our website at KARK.com if you missed any of it. Our web team already working right now to get that online for you. So there were quite a bit of announcements today. And if you're just joining us, good afternoon to you. Maybe you're just scrolling through your Facebook, or you just opened up our mobile phone app. The governor just held his weekly media briefing. There were several announcements made today. From COVID-19 to cybersecurity to ARHOME. So let's begin with COVID-19. 302 new cases of the coronavirus today. We're talking about 6 additional deaths and 1 additional hospitalization. The governor saying that he is not concerned about a spike in COVID-19 cases, saying that the latest spike, which is around 300, which has now happened twice in the last week, is likely due from the Memorial Day holiday. We also learned today that the governor has formed a cyber advisory council. This is because of various cyber hacking attacks across the world. You might recall the 2 different companies, an oil pipeline, also a meat processing facility was hacked. He's saying that in response to those recent hacks, he is now forming this advisory council, which will consist of technology experts and, of course, public safety officials. There are members from his cabinet that are going to be on this advisory council, including DHS official, including the Secretary of Education, Johnny Key, will also be on that. So several different announcements today. And then, of course, ARHOME, the governor implementing or announcing an implementation timeline on ARHOME and when that will officially kick off in the state. I do want to go ahead and show you just one more time that timeline that the governor just announced a few moments ago, and maybe maybe you didn't have enough time to look at it, or if you had difficulty seeing it, let me go ahead, bring it up for you here. This is the timeline that the governor just announced a few moments ago. June 13th, the state public comment begins. It has already officially launched. June 21st at noon, there will be a public comment hearing. The next day at 4 p.m., there will be another public comment hearing session. On July 12th, that is when the state public comment period ends. At that point, on July 14th, there will be, at this point, everything will be submitted to the feds. The feds will begin their reviews of it, and there could be a federal public comment section to happen thereafter. And then, of course, you see there, between November and December, approval is expected according to the governor. And at that point, we have manuals and rules and policies set forth. And you see it there at the bottom, January 1, 2022, ARHOME is officially kicked off in the state. This is the state's new Medicaid here in the state of Arkansas. There's a lot to process here. I get it, folks. Of course, we're going to continue to follow it for you here, both on air, online, and as we continue to work on gathering all of this information. Our Jay Burr also processing along with our web team, because if you missed any part of these dates that the governor just announced, we're going to have them on our website at KARK.com and, of course, Fox16.com. Really, however you get KARK and Fox 16, it will be on your mobile device or on television. So that is the very latest from Studio B here in Little Rock. Of course, as this story continues to develop, we'll continue to bring you updates both on air and online. And if you missed any part of our stream today, you can watch it back on our website in its entirety. And our next newscast is at 4 o'clock on Channel 4, Fox 16 News at 5:30. Of course, we have breaking news as it happens all day long right here on the device that you're watching. For now, I'm Mitch McCoy. I hope you have a good rest of your afternoon. And try and stay cool out there. I know it's warm. Take care.
This has been a special report from Fox 16 and KARK4.